afternoon and welcome. You're listening live to Heart, a program which aims to help you understand and to become your loving self at KMET 1490 AM, ABC Radio Live. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice located in beautiful Encino, California. And I'm here today with Dr. Robert Jaffe, who's also a psychotherapist and is my business partner. And we have been working together for the past 17 years. And today we are best friends, good colleagues, and beautiful partners together. And here we are offering this radio program to you. And we hope that you stay with us for the rest of the program. And welcome. And welcome.
Thank you.
So what do we have today, Dr. Jaffe?
So this program is about addictions, codependency, trauma, all impacting relationships.
Right.
And this is something that you and I both deal with probably on a daily basis with our clients. And people who suffer from this are at even more of a disadvantage than people who suffer from what we commonly know as addictions, in that the addictions that we call addictions are usually well known and well labeled. So we know that alcoholism is a very prevalent addiction. We know that smoking cigarettes is a very prevalent addiction. We know that any kind of drug, be it legal or illegal, that gets us into a high or changes our feeling state dramatically and gets us out of a normal, what we would call normal or average view of ourselves, those can be very powerful addictions. We also know that we don't need to imbibe a substance in order to have an addiction. Anything that changes our feeling state and gets us out of the normal flow of our emotions can be an addiction. It doesn't mean that everything that changes our feeling state and gets us out of the flow of our emotions is an addiction, but it can be an addiction. One of the biggest prevalent addictions that we call process addictions, of course, is gambling. And there are people who can gamble occasionally and have fun with it, and then go back to their everyday lives and not think about it. So the fact that you may gamble doesn't mean you have a gambling addiction. However, there are a lot of people who do have that addiction because the chemicals that are released through the gambling change your feeling state, get you to a new feeling state. You get high, and as a result of that, you may like that new feeling state so much that you go back to it over and over and over again, and you begin to neglect your life and sometimes neglect the lives of those people who are your family and friends and other people around you, because that feeling state is so powerful that
you want to revisit
you want to keep revisiting it over and over again. I was actually talking to a new client the other day, a woman who came out of a dysfunctional family, and I'm using the word dysfunctional to identify any family where the feelings of the person are not valued, are not taken seriously, and also the only thing that really matters is the person's behavior. So if all that matters is your behavior and your feelings aren't taken into account and your feelings aren't valued, you learn that your feelings don't matter. You stop becoming curious about why you're feeling what you're feeling. You don't understand how your feelings affect you. And so you sort of overlook all of the feelings that you have and all you pay attention to is behavior because that's all that was paid attention to. And what makes that dysfunctional is the fact that we all, as human beings, we live in feelings, and feelings are a central part of our life. And feelings are what motivate us, and feelings uh, give meaning to our lives. So if that part of our lives is not understood and paid attention to, and is undervalued, uh, then we start to lose meaning in our lives, and we look for things that get us to feel excited or really, really good. But those things, because our feelings aren't involved, those things only last for a short time.
And this is so true and so vital to understand and to learn about. And I know that myself coming from a different culture, and of course, I've been in the US for 45 years. So most of my life I have been here. And coming from a cultural background where expression of feelings, uh, was kind of limited,
Mm-hmm.
right?
Mm-hmm.
And I know that there are other cultures that expression of feelings are not promoted, are not welcomed.
Mm-hmm.
They are limited, and like you said, focusing on the behavior and achievements
Mm-hmm.
are more impressive, more valued, more essential than expressing somebody's internal feelings.
Mm-hmm.
Right? So we learned that actually from a very early age,
Mm-hmm.
that how for us to ignore our feelings,
Mm-hmm.
how to even don't pay attention to them and not recognize them. Right.
Mm-hmm.
And some of them are actually consciously are taught to us. Right. Mm-hmm. For example, boys don't cry. Right. And girls are not supposed to laugh out loud.
Mm-hmm.
Right. Mm-hmm. So there are so many overt and covert messages
Mm-hmm.
about how to preserve the feelings, to kind of shut them down, mm-hmm. how to not show them up, how to don't pay attention to them, ignore mm-hmm. them, disregard them, where in fact, when during the first 5 years of our lives, we function on feelings only. Correct. I mean, we don't use our cognition, our left brain, until at least age 5, or I mean, the onset of it is around that age. Right?
Well, I'm going to say that I mean we do have cognitive abilities earlier than that, but mostly we respond based on our feelings.
Based on our feelings, so there is the feelings that tell us jump from this table to that table, and just feel free,
Mm-hmm.
just be expressive, right?
Mm-hmm.
In adulthood we say, oh, I feel like a kid, so mm-hmm. that means they are my feelings who are now guiding me.
Mm-hmm.
Right. So, but what a crime it is that we learn not to express our feelings.
Yes.
What a crime it is for us to say, we don't want to hear about your feelings. Just focus on achievement. Focus on, making things happen. Focus on the behavior. Be modest. Be appropriate. Be, respectful. Be all of that.
Mm-hmm.
But nothing about feelings.
Right.
Where in fact, that's how we actually, wake up with our feelings. We go to bed with our feelings. It's the feelings that guide us 24/7.
Right. And so when we hold back our feelings, we start to not understand that we have them.
Right.
It's called repression. So think of it as holding something in place, and there's pressure for that thing to move forward, and you're holding it back. And so the pressure of the feeling wants, what do our feelings demand of us or want from us? Our feelings want to be experienced, and they want to get expressed in a way that elicits understanding, empathy, compassion, connection. with other people. Our feelings are the things that connect us with other people. It's the thing that we all have in common.
Right.
Everyone has the same feelings. Now, that being said, that's not to say that everyone feels the same about everything. But we all know, every human being, by virtue of the fact that they're a human being, we all know what sadness is.
Yes.
Yes. We all know what annoyance is. We all know what frustration is. We all know what anger is. We all know what joy is. And then, of course, as we start to get a little older and we mature, we all know what it feels like to feel sexually aroused,
right,
and to feel sexually turned on. These are all common things, and the more that we can express those feelings to our fellow human beings, the more our fellow human beings can relate to us, and the more people relate to us, and the more we relate to others, the less alone we feel in the world, and the better we feel about ourselves because we have other people that we feel connected with. When we don't express our feelings, the reverse happens, and we're not as connected with other people. That leads to loneliness, and it leads to isolation, and that brings us kind of a full circle back to dysfunctional families. Because in a dysfunctional family, since your feeling doesn't matter or isn't valued, or worse yet, is discouraged, then if you express a feeling, what you get is criticism. You may get a strong negative facial expression or reaction, and you also may get punished. You may get punished physically if you're in a family that says that physical punishment is okay. You may get slapped or hit or strapped. And you may also be punished in other ways. You may have to, quote, go to your room, or you may be grounded, meaning that you can't go out and talk with your friends or be with your friends. There's a lot of ways that people express the displeasure of other people expressing feelings. And one of the reasons that it becomes so powerful in families is that if the parents were raised to believe that your feelings are a hindrance and that don't matter, and the child begins to break that rule, and let's say starts to get happy about something and very excited about something, and the parent was raised with the belief that you're not supposed to show happiness or too much excitement, and the child is feeling that happiness and that excitement, the parent will start to feel their own happiness and excitement come up because they're relating, but then they have to repress it because it wasn't safe for them to show that in their childhood. And as a result, they try and hold it, they try and keep the child from expressing it.
Exactly.
So we just got notice that we're going to have to take a short break. Please stay with us, and please feel free to call us and let us know what you think about all of this.
951-922-3532. See you shortly. Welcome back to the show break. This is Heart to Heart program at KMET 1490 AM ABC News Radio Live. Dr. Mitra and Dr. Robert here, and in today's episode we're talking about problems with expression of feelings with Dr. Robert Jaffe. And we would like to invite you to please join us by calling us 951-922-3532. And I'm going to use this moment to also give you an update about our program, which as of September 9, we're going to be on the show from 4 to 5 instead of 3 to 5. But we do hope to, for you to join us, of course, at that time too. And we're going to offer you the similar programs. We may have a guest, at our show. But there are going to be some changes, and we hope that you enjoy those changes. So we're going back to Dr. Robert Jaffe.
Thank you.
Sure.
Thank you for the update. So, what we were talking about prior to the break was we were defining a dysfunctional family and saying that what makes it dysfunctional is that expression of feelings is prohibited or limited. And so the child is taught that their feelings are wrong, are bad, don't matter, or that by expressing those feelings, they're breaking a rule. And therefore, they learn how to repress and suppress those feelings um, and grow up with the belief that if they have feelings, that they need to keep them to themselves or they have to walk on eggshells, and be very careful about how they express their feelings. And so people grow up then feeling very, very inhibited. Um, what happens if you are inhibited? You're holding back. Feelings are emotions. Emotions are E dash motion, right? E stands for energy. Motion is movement, right?
Yeah.
So emotion means your energy is moving, and that's what emotions are. So when people say, "Well, I'm sorry that I'm crying," which we sometimes hear in our practices, excuse me, as their eyes start to water.
Beside that, and I'm sorry to interrupt, but we see that when people cry, we immediately cover our face.
Right.
That's definitely an expression of shame. I'm not supposed to cry.
Exactly. Exactly. So that means that they haven't been given permission, and they now don't give themselves permission to cry. And oftentimes people will hold it back and they won't cry, but then there's times when the person just can't hold it back, and so their tears start coming out, and then the person feels ashamed that they're actually doing something, and then they apologize for it as though they're doing something that the other person is going to find offensive.
Right.
Right. So why are we talking about this? Because we're talking about addictions and we're talking about codependency. I started to say before we had to take our break that I had a new client who came from a dysfunctional family, and then I went on to explain what a dysfunctional family was. But she came from a dysfunctional family, and as a result, she didn't know. She always felt inadequate. She always did. She felt like she wasn't very attractive. She felt like she wasn't desired or desirable. But then when she became 17, she went to a party and they had alcohol at the party, and she took her first drink. And when she told me this, her whole face changed, and she said, "I took my first drink, and oh my goodness." And I looked at her and I said, "You thought you found God, right?" And she said, "Absolutely." She said, "I thought I felt God because all of a sudden I felt free." And that's because the feeling of the alcohol freed her to not have to repress her emotions. And so and so from that, she started to use alcohol and eventually relied on alcohol. And now she's struggling with her alcoholism. Mm-hmm. But and now she's with somebody also who is an alcoholic, and they try to get sober together, but then one of them slips and then the other one slips, and so that's where they are right now. So what does this mean? It means that we use things to make us feel better because the way we're feeling is not okay. What makes us feel better? Sex can make us feel better. Alcohol can make us feel better. Gambling can make us feel better. Marijuana can make us feel better. Cocaine, heroin,
chocolate.
What's that?
Chocolate.
Chocolate. Yes, 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 yes. Chocolate. Yeah, chocolate cake. Oh, I love chocolate cake. But all of these things can make us feel better. So what's wrong with feeling better? Absolutely nothing. Everybody wants to feel good. right?
That's why we do all with the addictions, right?
Exactly, exactly. So if the addictions didn't work and didn't make us feel better, they wouldn't hold any allure to us, and we wouldn't do them. However, we there's a difference between what my client experienced at 17, having a drink and feeling like she found God, and someone else who's at the party who didn't come from a dysfunctional family and had a drink and may have enjoyed the drink and may have enjoyed the high feeling, but it was okay. It wasn't wonderful. It wasn't like that wonderful. So it was okay, and they enjoyed it. But they didn't like walk away going, "Oh my God, I can't wait till I have that next drink." And so that's one of the big differences with people who have a lot of repression and have a lot of interference with their good feelings, their normal good feelings. They're carrying a lot of emotional pain inside of them, which they then get relief from immediately from the drug, the alcohol, or the process. We talked about process addictions like sex or gambling. So they get relief, but then as soon as the addiction wears off, or they stop the gambling, or they're not drinking, the negative pain and feelings and the repression replaces itself because they haven't dealt with the thought patterns and the belief patterns that are already there, and so therefore they need to get relief again and again and again, and after a while, the relief that they get becomes much more difficult to attain because they get their bodies get used to it, right? So you have to do more in order to get the same feeling.
Yes.
And
Yeah.
eventually you can't do more. So what happens is you start to use your addictive substance just to feel okay, not even to get high. And so you can develop a tolerance, for example, for alcohol. So somebody who's an alcoholic can go out and have 5 or 6 drinks and not get drunk because they've developed that tolerance. They have to have 8 or 9 or 10 drinks in order to really feel something. So uh, so the addictions that we know of, that we label addictions, which we just commented on, are very, very powerful, and many people, millions of people in our country and throughout the world suffer with addictions, these kinds of addictions. However, an even greater number of people, millions more, suffer with the unnamed addiction, which we call codependency. Codependency means that you grow up in the dysfunctional, going back to what I said before about what dysfunctional means. They grew up in the dysfunctional family system, and what they discovered was that they didn't necessarily need to get high. What they needed to do was to keep things level, because there was a lot of drama in the family. Um, so if there's drama in the family, meaning there's a lot of fighting between the parents or between the parents and the children, there's name calling. There can be physical abuse. There can be sexual abuse, but often it's emotional abuse.
Right.
And the emotional abuse means that the child just wants to feel safe, emotionally safe, physically safe, and so they take up roles in which they learn how to work the parents so that they can feel safe.
Mm-hmm.
These roles are personality components and traits that each person assumes within the family in order to make them feel okay.
That's where, for example, identified patient comes in.
Right. The identified patient is the person is usually one person in the family.
Or the scapegoat.
Well, the scapegoat actually is the identified patient. Yeah. The
scapegoat or identified
Yeah,
patient.
where one person gets blamed. Often it's the person with an active addiction, and if it wasn't for him or her, we would all be fine. Not realizing that each of them has a part in the creation of the family dysfunction. But going back to codependency and the personality disorders or the personality traits, in this book that I use, which I have called the Bible of Codependency, the name is Codependence: Healing the Human Condition by Charles Whitfield, published in the 90s, but still very, very powerful and very accurate. He identifies, I think there's like 15. Let me just take a quick look here. 8. Yeah, there's 15 that he identifies places, roles that people can assume within the family that keep that person who's assuming that role feeling emotionally safe from all of the drama and all of the dysfunction that's going on. And the first one that he identifies is rescuers and fixers.
So before we go there, I have a question. This process happens so unconsciously and so uniquely. Nobody decides consciously to be the rescuer, for example, or the scapegoat.
Correct.
Right?
Correct.
So there is a mechanism that causes one child, for example, assume the role and then take all that burden on himself or herself,
right,
so that the rest of the family stays safe and stays supposedly functional.
Right.
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 What causes that for that one individual, for that one child, to subconsciously or unconsciously assume the role?
Yeah, and the short answer to that is we don't know.
We don't know.
Yeah, we don't know. Actually, it's sort of like I believe that each person is born into the world with their own unique sets of gifts, which include their own unique sensitivities. Mm-hmm. So there are people who are born into a family. Everybody is born into the family with their own unique personality. Right. And so to ask, why does this person, for example, in my family, I was the peacemaker, and I didn't want to rock the boat, and so I would never go against anything that my mother said, because my mother would have a flare up of a temper. She would get very abusive and harm things that we cared about, and she would even hit, and so those kinds of reactions I took as, oh, okay, I better not rock the boat. Now, my sister was very confrontive, and my sister says, I'm not going to put up with this crap, and if you don't treat me the way that I know I need to be treated, I'm going to say something. So my sister responded by being confrontive. I responded more avoidant. And so my sister, because she was confrontive, she got picked on a lot more than I got picked on. And, I see. Yeah, and so she became somebody who, and since my mother did it, my father couldn't support my sister. My father was on my mother's side. Then my sister felt isolated, and she felt like she was the identified patient in the family. I see. And she started to act out in that way. But that's based on her unique personality. Exactly. And the way that she dealt with things. Right.
So basically, it's a defense mechanism.
Yes. Yes. These are all defense mechanisms. Yeah. And what you and I talk about often is the need for safety.
Right.
That the primary need that every child needs is to be physically and emotionally safe. Right.
So, and that's why you're today, so diplomatic.
That's correct. Yes. No, that's correct. Yeah, that's correct. So diplomatic. Yeah, because I learned how to be diplomatic.
Yes.
I also had to learn how to be assertive.
Right.
Because I would be very compliant and I would go along with things. And I also learned because I suppressed a lot of my resentment, my anger, my frustration. I also suppressed a lot of my happiness and my excitement. So when I was very young, I learned not to get excited. I learned like a poker face.
Right.
Like I would just have a poker face and I wouldn't show much of anything. And my parents knew that I didn't show excitement. but they had no idea why I didn't show excitement. They thought it was just part of my personality that I just didn't get excited about things. I remember when I was 12 years old, I really wanted this Schwinn Super Continental 15-speed bicycle, and they got it for me. And I looked at it, and I smiled, and I said thank you.
But there
And,
was
and
no
and there was no
excitement.
excitement, and but they weren't surprised, but they had no idea why I wasn't showing it. So yes, it certainly helped me. It helped me to do my profession now because I do know how to be very diplomatic and express. But I had to really learn how to express, how to assert myself. So the first one we talked about was rescuers and fixers, and we will come back to that in a few moments. We just got another notification
Yes.
that we're going to have to take a short break. Please stay with us and feel free to call us 951 Any comments, questions, or observations are welcome, and we'll see you in a moment.
The free phone app today.
Welcome back from our commercial break. Dr. Mitri and Dr. Robert here at KMET 1490 AM ABC News Radio Live at Heart to Heart program, where we're talking today with Dr. Robert Jaffe about expression of feelings. We got to the point of, the identified patient and scapegoat, and he shared about himself and how he became the very diplomatic person that he is today, right?
Yeah.
So, well, thank you for sharing that aspect of yourself with
No,
us.
no problem. Happy to share. I've done enough personal therapy. Not that I'm done. I'm always trying to understand myself at deeper levels, and the more I understand myself, I think that the more useful I am to both my clients and the people in my life, because um, I'm trying to think who it was. Someone, it wasn't Aristotle, but somebody way back, said, "Know thyself, know thyself." That's the most important thing that you can do is to know thyself, because as you know yourself better, you understand yourself better. You then understand other people better, and you become much more tolerant and more forgiving and also more empathic,
Yeah.
more empathetic with other people. Um, there but for the grace of God go I. And so when I hear people, making statements about other people that are clearly unfeeling, uncaring, prejudice statements. Prejudice simply means prejudged, because the person is homeless, or because the person has a disability, or because the person doesn't have the same emotional intelligence, or any kind of intelligence. I say, am I my brother's keeper? And I say, to a large extent, we are. To a large extent, we are supposed to care about other people, and that's why we're here, is to help the world through caring about other people. That does not mean that we don't care about ourselves, or in a lot of cases put ourselves first. I think we're supposed to do that as well, but that doesn't mean that we have to make ourselves win at the expense of other people losing.
Exactly.
That's my belief.
Exactly.
So, going back to dysfunctional families and codependency, in this book that I'm quoting from, there's 15 ways in which we protect ourselves emotionally, coming from dysfunctional family backgrounds. And one way, and you were asking a great question before, what makes one person take one role and another person another role? And I think the answer is the differences in personalities,
Right.
and the gifts that we come to the earth, the things that we are good at, or that we know how to do, that comes easily to us, we gravitate to, and we utilize those things, you know. So whatever we have that seems of value, we utilize that, and we try and cope with it, and we try and use that to our advantage. And I think that's okay. That's what we're supposed to use to our advantage. You know,
Right.
you know, if you are especially pretty or handsome, you can use that to your advantage. There's nothing wrong with that. You know, if you're exceptionally artistic, you use that to your advantage. If you have other gifts, you use those to your advantage. There's nothing wrong with that, as long as you're not trying to win at the expense of someone else losing.
Exactly. Yes, which is that would be a selfish
Well, that
process.
yes, yeah, that would be well, yeah. I don't think of selfish as a bad word. I think selfish is what we all are, but I think to find the place where we can be both selfish and unselfish.
Well, when you said at the expense of another person,
At the
that would
expense,
that would be
that would be not caring.
not
That would be an
caring.
uncaring, and I think uncaringness is what gets us into trouble in the
Right.
world.
Right.
I don't think it's our selfishness. Because we're all selfish. We all want to, do the best for ourselves. Most of us do anyway. But that doesn't mean that we don't have to care about others as well and try and help others as best we can. So, so rescuers and fixers, okay, they try to fix or help others, and often they do that at the expense of neglecting themselves. So that's one role that the person can take in the dysfunctional family, and that was actually my role in the family, because my mother was very emotionally unstable, and my mother would go into fits of rage, and as a result, my father would say, "Well, you have to understand her." And basically, the message he was giving me was, understand her, but don't have your own feelings about what's going on. So I had to suppress my own feelings and understand her, because I knew that if I didn't, I would not have his support, and then I would lose both of them. And as a child, we can't afford to do that because we know we can't take care of ourselves.
Right. And we
So
need
we
them.
need the support of either one or both of our parents. Yeah.
So, for example, and this is a personal question I'm asking you. Please feel free to decline to answer. Do you think that some of that, behavior or belief has continued to stay with you today?
Oh, absolutely. Absolutely.
Okay.
Sure. 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 Because the things that we learn, you were commenting earlier that when we're born and for the first several years of our life, we are emotions. So what we learn is at a very deep emotional level in the first few years of life. We observe what's going on. We make sense of it through our emotions because our intellect is not developed enough.
Right.
So those become deep, deep emotional imprints that stay with us for the rest of our life. Now, that being said, the more you understand what's going on, both understanding, meaning understanding at an emotional level and at an intellectual level, the more you can modify. And so I've modified a lot of my behavior. I've modified a lot of my thinking processes, but I still have some of it. And I think we will always have some of it.
Right.
Yeah.
Right.
Yeah.
Yeah. And hopefully we keep the some of it that is working to our advantage, not disadvantage.
Yeah. Yeah, exactly, exactly.
Yeah.
There's nothing wrong with me having some rescuer part of me, but and especially rescuing women was running me for a long time, and I would be drawn to women who needed rescuing, and I would enter into relationships, and that was unhealthy, because you can't rescue somebody in that way. Um, you can rescue somebody if they're drowning in an ocean. You can jump in and rescue them, but you can't rescue them from their emotional disturbance in a relationship. That person has to do the hard work of understanding and helping themselves.
Right.
Yeah.
Right.
Yeah. So, but now at this point, that pattern has changed. I'm not drawn to women that I have to rescue. So that's a good thing.
Congratulations.
Thank you.
And thank you for sharing about yourself.
Yeah, absolutely. So that's one thing, is rescuers and fixers. The second one is people pleasers, right? So people pleasers, they have unhealthy personal boundaries, and they would rather acquiesce and comply with others than express their own healthy wants and needs. So and so in a dysfunctional family, uh, if you have one or both parents who you know are not operating with, let's say, a full deck, right? They're not operating from a reasonable, logical, they're not lovable, they're not acting in a loving way. Then you don't want to upset them. You do your best to try to please them so that they can be as loving and as reasonable as they possibly can. So you adapt that, and then of course when you grow up, you hold on to that until and unless you become aware that that's an issue for you, and then and if you don't become aware of it, you get into relationships where your job is to please the other person, and the other person then starts to expect that from you. And then if you want something back from it, the other person starts to feel resentful because that's not the contract that you signed with them. You signed up that I'm here to please you. And that person has their own stuff going on why they would want that relationship. But we're talking right now about the person who adapts that kind of behavior as a people pleaser. They please the other person, they do their best, and the other person gives them a thumbs up or a thumbs down. And the people pleaser feels terrific when they get the thumbs up and feels horrible when they get the thumbs down.
Yeah.
And if they never grow out of that, they can stay in that relationship for the rest of their life.
Yes, and I mean these are the behaviors that they run us, subconsciously, unconsciously.
Exactly.
Unless they are pointed out, unless we are aware of them, unless we can recognize them, unless we get to a point that we no longer can tolerate ourselves that way.
Right.
I should say.
Right.
We're not going to look into why am I behaving the way I'm behaving, because we even don't know, we can't recognize what kind of a person we are.
Exactly.
Unless when we go to therapy, and through that process we can understand whether we are a rescuer or a people pleaser or whatever else we are, the rest of the book that is talking about.
Exactly. All of these are signs of codependence, and codependence is when we're trying to make up for a lack of internal nurturing. We don't know how to nurture ourselves. We haven't been nurtured, and we don't know how to do it for ourselves. So there's that emptiness, and these ways of doing it that I just commented on, the people pleasing and the rescuers and fixers. That's a way of trying to fill that emptiness. The third way is something that many people identify with. It's called overachievers.
Why are you laughing?
We know why I'm laughing. So, overachievers try to fill their emptiness through achievements, right? And so they can become very, very good at a number of things, and what they're looking for is that approval and that love from the people around them to say, "Oh, you're so wonderful, you're so great," and that will fill them up. But they do it through trying to do it through external achievements. And there's nothing wrong with having external achievements, and having external achievements is a wonderful thing, but it doesn't really ever fill that emptiness. So, but a lot of people do that, and it's very, very common in our society and in others as well.
I have to say that I have some of that.
Uh-huh.
And you're laughing. She's saying that's an underestimate.
I'm just listening.
I mean, I can remember that once I, start a program, start a process, and I make it and I'm done with it. And I look at it and I look at the finished product and I say, oh, awesome. Okay, On to the next one.
On to the next one. Yes.
Yeah.
Yes, exactly. Exactly. Yeah.
So, I mean, this thing happens, and but I think among all that list that you have, overachiever, at least, I'm doing something for myself. I'm making progress here.
You have the better dysfunction.
I have the best.
Okay.
I'm pleasing myself.
You're
I'm
pleasing
myself.
yourself.
Yeah.
Okay. So and so we just did 3 of them. I told you that he mentioned 15 of them. We have some more time next week, and we will go over some more of these. But I want to thank everybody for listening. Please feel free to comment on our Facebook page. Let us know that you're listening. Any questions that you have, we love to hear from you. And so we are just about to end the show. And I want to just say thanks everybody for joining us. Thank you, Mitra, for being my partner and for doing these shows with me. It's a pleasure, an honor.
Thank you.
I feel great.
Thank you.
And so until next time, next week at 3 o'clock, addictions and codependency. And until then, all you need is love.
Bye-bye.